Hello, my name is Karen Twyford and I am talking about our recent scoping review on the functional outcomes experienced by children and adolescents with a neurodisability who access music therapy as part of their neurorehabilitation. The impact of a neurodisability can have long-lasting consequences, and early interprofessional neurorehabilitation is key to improving functional outcomes, particularly for children and adolescents. Music therapists work in interprofessional neurorehabilitation teams, providing interventions to contribute to functional outcomes and to support quality of life and well-being. Music engages the global network of the brain and is effective in connecting the physiological, psychological, cognitive, and emotional components addressed in physical rehabilitation. Music can therefore be a useful rehabilitation tool due to the motivational and emotional role it can play in a patient's recovery. Evidence demonstrates the effectiveness of music therapy for functional outcomes within adult neurorehabilitation. However, the evidence cannot be generalised to a child population, and less is known about the emerging paediatric literature base. We completed a scoping review using JBI methodology to determine the extent, range, and nature of existing evidence for functional outcomes experienced by children and adolescents with a neurodisability who access music therapy as part of neurorehabilitation services across the rehabilitation spectrum. We framed functional outcomes according to the ICFCY framework, which is the International Classification of Functioning Disability and Health Child-Youth version. We utilised the Population Concept Context framework to conceptualise our eligibility criteria and included a population of children and adolescents with neurodisability from 0 to 18 years who typically access tertiary hospital services, but not those whose primary conditions involve mental health conditions and/or neurodevelopmental disorders. Our concept included functional outcomes as framed by the ICFCY, and our context involved music therapy interventions in tertiary healthcare and community settings. We developed a search strategy to search online databases and utilise the PRESS checklist. Our protocol was registered on the Open Science Framework, and we reported our findings according to the PRISMA Scoping Review reporting guidelines. We searched 8 online databases and completed a web-based grey literature search. After full text reading, reference screening, and expert knowledge user consultation, we included 53 original primary sources for data extraction. We utilised summative content analysis and charted a range of general, participant, and intervention characteristics. We found international representation of evidence spanning 40 years and published across 27 journals. Sources included a range of types and study designs and utilised a range of outcome measures. Our sources included a variety of health conditions across the spectrum of care. 75% of sources involved music therapy specific interventions and 25% detailed interprofessional collaborations. The ICFCY framework was used to map the outcomes of children and adolescents with a neurodisability. We found that all 53 sources reported body function impairments and addressed at least one identified area. 70% of sources reported outcomes across multiple areas of impairment. Nearly all sources reported activity outcomes and 60% reported participation outcomes. A lower number reported outcomes relating to environmental and personal factors. We determined that music therapy as part of paediatric neurorehabilitation strategies can provide a holistic approach to impact a range of physiological and psychological outcomes, with physical, communication, and social outcomes addressed the most. Music therapists use a wide range of music therapy methods and techniques depending on the area of function targeted. Music therapy is effective as a standalone treatment and within collaborative team approaches. Further evidence is required to guide best practice and to validate the inclusion of music therapy as part of core rehabilitation services across the spectrum of care. Education and identification of the active ingredients that differentiate music therapy from other disciplines is key for the role of music therapy in paediatric interprofessional teams. Thank you for listening.